In today's video, I want to talk to you about how to pick out a prenatal vitamin. My name is Dr. Shannon Vanderdolen. I am an Ontario-based virtual naturopathic doctor with a focus in fertility, pregnancy, and postpartum care. And if you're in any of those three groups, you're going to want to be taking a prenatal vitamin. So the reality is there are so many prenatal vitamins available on the market. If you walk into a drugstore or your local health food store, you're looking online, the options seem endless. And each brand and each product seems to somehow promote that they're better than the next. So how do we pick? How do we be informed decision makers about this really important supplement we need to take? So first, a few things to consider with your prenatal vitamin. One is that you are going to be taking it for a pretty long period of time. So it's generally recommended you start taking a prenatal vitamin at least 3 months prior to getting pregnant. Certainly you could be taking it a little bit longer. And if you're already wanting to get pregnant like yesterday and you haven't been taking one, starting sooner rather than later is definitely better. So generally we recommend about 3 months. You're going to be taking it throughout your entire pregnancy. So that's about 40 weeks. And then you're probably going to be taking it postpartum for a little while. I generally recommend people continue to take it if they choose to breastfeed or if they're pumping breast milk to just help support their nutrition. If you're not breastfeeding, you may end up discontinuing the prenatal a little bit sooner. But generally, I still recommend to take it for at least 3 months postpartum, almost treat it like a fourth trimester at the end, just to really help you recover from pregnancy and labor and delivery. So it's a pretty long-term commitment. So I do recommend that regardless of which product we end up choosing, we want to make sure it's one that we tolerate well, that we feel good about taking. If your prenatal vitamin is making you feel nauseous, if every time you open the bottle you want to throw up, that's not something you're going to be able to commit to for at least a year. So we do want to make sure at minimum we're choosing something that we tolerate well, that jives well with our body. And that might mean trying a couple different products and seeing. Certainly some have higher concentrations of certain vitamins or minerals than others. And as a result, some are going to be a little bit easier for us to take and some are going to be a little bit more challenging. Another important consideration with a prenatal is to make sure you're timing it well. I always recommend taking it with food. That's not only going to increase the absorption of certain vitamins and minerals in the prenatal, but it's again going to make it just more tolerable for us. It's going to contribute to less nausea or upset stomach. There is some research looking at different types of prenatal vitamins, and while there isn't, one study that says this brand is the absolute best, it is suggested that it's really challenging for us to get everything we need in a one-a-day vitamin. So a lot of prenatals will say that you just have to take one a day, and while that's very convenient and easy, that might not provide actually the best benefit for our health. So it is recommended that we look for one that has, you need to take multiple capsules a day. The ones that I use in my practice typically have to take 3 or 4 capsules a day. Usually I just recommend take one with each meal or maybe double up on one meal to try to get them in. So what to look for? How do we know that we're picking a prenatal? I'm not going to sit here and tell you to take a particular brand because there's lots of really good ones available. And I do rotate through quite a few in my practice. So I'm not necessarily loyal to one product or one brand. I think there's reasons we might use one over the other in certain situations. But generally speaking, a good rule of thumb and kind of one ingredient to look for on your prenatal that will kind of tell you that you're looking at a good product is if we're looking at the form of vitamin B9. So vitamin B9 is also called folate, and folate tends to come, at least in a supplement form, in 2 different forms. So one is something called folic acid. This is considered the synthetic form or inactive form of vitamin B9. When we take in folic acid, our body needs to convert it into the active form of folate before we can use it. And then the other form that we might find in a supplement of vitamin B9 or folate is called 5-methyl tetrahydrofolate. Sometimes that's abbreviated to 5-MTHF. And if you see this form of folate in your prenatal, this is kind of what tells me that this might be a good quality product. This form of folate is considered the active form of folate. Our body can utilize it, doesn't need to convert it into anything else. The reason why this might be important is because it is estimated that about 50% of the population can't really efficiently turn folic acid into this active form of folate. And that's really important when it comes to protecting against like neural tube defects, supporting the baby's brain and nervous system development, supporting other functions and kind of cellular development of our baby. So if you're looking at a product on the shelf and you're debating between 2, if it has more than 1 capsule a day, that might be better. And if it contains the active form of folate, the 5-methyl tetrahydrofolate or 5-MTHF as your form of vitamin B9 or your form of folate, that's generally a mark that you're on the right track. If you have any questions about prenatal vitamins, definitely feel free to speak with your naturopathic doctor. I'm accepting new patients into my practice, so I'm happy to consult with you if this is something that you're needing some support with.